computer.
Yeah.
All right, we're
So
recording.
it's recording on mine. Perfect.
Yay! So should we just go in order? According to the
Well, I think that we probably have created similar questions. I would imagine, at least in some degree, some of them overlap. So if you want to start, that's fine. And then we can just interject as, like if we have one that's similar, then we can just have a group, I guess, discussion about if it's one that we would keep. I mean, ultimately, I think it's about the process, as I understand reading this assignment. Like, we don't actually have to submit a list of final questions rather than just submit the video. So if you want to start with, we can talk about how we would do the introduction or like the basic warm-up question. And if we all agree on that, then we'll just move through our lists. And once we're done with them, then maybe that'll be it.
Yeah, sounds good. Okay. So I started the interview questions being, let's just begin by having you describe your role.
Yeah, I had the same question.
Okay.
Yeah, I just put, what's your current position? And then a more probing question being, how long have you been at that current position?
Okay, cool. Yeah, I like that.
The only thing I added to that, only because of the disqualifier or the qualifier in the assignment saying that to be selected, they would have to have been there for at least a certain amount of years. I just had, describe what a normal day looks like within that role, just to get them talking and potentially then leading us to any further information that we thought was interesting.
Yep.
It might be important too to note if there are multiple athletic trainers at their high school. Because that may change, like, do they actually work football as a main sport, or do they work lower risk sports for concussions also?
Yeah, I wouldn't disagree. I think, if we were doing this for real, a combination of all those things would be a great way to start.
Right. Okay. So just moving on to number 2, what has been your experiences with the concussions at your school over the past year? Now, I was kind of hesitant about adding over the past year, but in the requirements, that was one of the requirements, that they had to have experience with concussions over the past year. Thoughts?
With that, I also added, and I wasn't sure if some of these we kind of lead them on or kind of change their answers, but also adding such as how many, what sports it was with, and if there were any significant experiences which stand out to them, just to kind of get them talking on, hey, maybe this person had this major concussion that they had that changed their perspective or how they do things versus somebody else who's had pretty typical concussions.
I think that makes sense. I guess in no particular order, it doesn't really matter how we would formulate this. I guess in my head, I was thinking more on the front end with a first question from an interview standpoint, just trying to establish kind of a baseline for how they manage the injury in general. So thinking about, does your current setting have a formal policy on how to manage concussion as far as, well, I would just leave it at that. But just with my thought being that it would give some information towards, is there certain paperwork that they do from a baseline standpoint? Is that, those are some of the ideas that I would hope to gather from that. And understanding that that's a closed-ended question, I had branching off of that. If they said, yes, we do, then I would just please describe the general framework of that policy. And if they said no, then I would just ask them, since it's not formal as a written policy, what's the general procedure that you try to follow whenever that injury occurs? So
that was my next question, actually.
Yeah, perfect.
Yeah. I did have I kind of phrased it, can you explain the management of a concussion from beginning to end for me, please?
Yep.
And I added a probe in there, kind of like a mini tour, as that one guy said on his PowerPoint presentation, but any particular test they utilized during that whole process, during the protocol.
What are your thoughts? I had another probing question idea specific to the policy, whether or not there were any laws, local or statewide, in their setting, in their particular environment, that would govern that policy. Thinking just right now, I believe that every state if uh-oh. Are you still hearing me? My computer's updating something.
Yeah.
Okay, perfect. Sorry. But I believe that every state at the secondary school level currently has statewide regulation in some form from a concussion standpoint.
Mm-hmm.
I don't know that for a fact, but I thought I heard that statistic somewhere. So I thought that would be interesting just to get the individual's take on where the law was governing what their clinical practice was versus what their clinical decision-making was.
Yeah.
It's almost like there's several layers of the protocols and things, like the state level, and then almost the school and the district level, and then also their personal level from their experiences, how they deal with things.
Sure.
So formatting the questions in some type of order based on that would be a positive thing.
Mm-hmm. Well, physicians as well. Some physicians might go different routes
That's true.
with management.
Well, it sounds like we have a pretty good consensus, at least for those two questions that we discussed, and specifically the one just generally about policy and what the probes might be to get a better understanding of how each person does it. Is it formal or is it informal, and if so, how that looks.
Yeah. I kind of added in actually to the next question, what goes on during the referral phase. Again, not trying to be closed-ended, trying to be more open-ended, but just allowing that person to describe the referral process. That also might be kind of a pro because that's a part of the management side of things as well. So, but I just kind of had it be its own question.
Yeah, when you say that, are you thinking more the logistics of how a referral works, or are you thinking specifically to what other providers they utilize for referrals?
Specifically for their actual process of the referral.
Okay. Yeah, that makes sense. And because one thing that I struggled with was trying to identify a probing question for this, which actually what you just said might fit into it. A question I had listed was just please list the titles of other individuals that are involved in the management of concussion for a student athlete and a brief description of their role. So with the aim of trying to get at, do they utilize, with the idea of a team-based approach, do they utilize the school nurse? Do they utilize the guidance counselor for return to learn? They communicate with parents. So if there was an overarching question about identification of what the team is, the titles and the role of other people associated with it, a probing question might be yours of describe the referral process to each of these individuals that you just listed.
Yep.
One thing that I listed was, how do you go about determining whether or not to immediately refer a concussed athlete, and what are the resources for that or the time frames? Because they may have instant access, like y'all said, with the school nurse, which your question may have done that, but like what determines whether they send them to the team or the school nurse or the doctor, or immediately send them to the emergency room?
Yeah.
Do you think, I agree, and I think that's absolutely imperative to include. Do you think that might fit also as a probing question to our first one as far as policy? So after they identify what their policy is, if it's not mentioned in that, a probing question could be, what in the policy dictates an immediate referral to MD, ER, whatever it might be?
Yeah, that way we at least have that specified so that we can look at, if we were going through all of the data, we could be like, okay, looking at that as a string of this is the same, this is the same.
Sure.
Oh wait, this person does something a little different.
No, I think that makes a lot of sense. I didn't think of that.
Yeah.
One thing I also put was, how has your concussion management plan changed during your athletic training career? Since these have been practicing athletic trainers for 5 years, I would assume that as they've gone through those 5 years, they've seen different things and maybe changed their protocol, their personal protocol.
Yeah, I actually kind of wrote my next question kind of similar. I said, what do you feel about the current concussion management techniques used at your school? Ultimately hoping that the interviewee would kind of talk about maybe some quality improvement that could go on there.
I like that. the question, I think we're all going to have similarly guided questions, but the one that I had in line with that, but I think I like yours better, had to do with just describing an individual's educational background in concussion, trying to get at, whether or not they only learned what they currently know based upon their professional education, whether or not they've attended any specific continuing education, whether they've been reading, staying up to date on things like that. But I think it makes more sense to get that picture of how has it changed. And then a potential probing question could be, what was the impetus for those changes? Did you attend a session that was different from what you had learned in your professional education or something like that? So I like that idea.
And then I also have, what challenges have you noted in the management of concussions in your setting?
Yeah, no, I think getting at challenges is good.
Yeah.
A probing question of what have you done to try to overcome these challenges? One thing I had written down, and the more I say it, I think it actually potentially could fit into a probing question for the first one we had talked about as far as policy, but or even fit into what you had asked about, Mary, with I'm sorry, is it Mary or Megan?
I go by Megan, but
okay, Megan. As soon as I said that, I was
Mary.
like, that's what email said, but that wasn't what she signed it as. Okay, Megan. But to go off of the idea of policy is, and your idea of immediate referral is, what instructions do they give a patient after the initial evaluation? Because I always think it's interesting to find out what clinicians say to, do they include the parent in that process and say, these are the signs and symptoms you should look for in the next 24 to 48 hours, so on and so forth. But I think it would be interesting to identify, do they have a set list of instructions that they give? Is there an informational handout that they give them, or is it all done just kind of informally via, phone if the parent's not present or something like that? So
another thing, again, it might go back to management though, is return to play. Any specific return to play protocol that might need to be put in place, especially for those that might have other more severe issues, hematomas or whatever.
Sure.
And just like, do they do SCAT3 baseline testing or impact testing, or what kind of, or even when we go back to the education of the athletes in general? I mean, I feel like that's not really a management referral, but once you have somebody with a concussion, how much do they already know about it beforehand? And I'm not really making a lot of sense, but do they have educational sessions for all of their athletes so that other athletes can help detect concussions also? And so are coaches on the same page in awareness of, hey, well, if your coach sees somebody who has a head impact, are they going to refer them to you also?
Yeah. I like what you're saying. I'm trying to relate it to the research question of being specific to concussion management and referral. I wonder if that would fit in. So if they would say yes, that they do educational sessions, then we could ask a question, based on those educational sessions, have you seen an improvement in the meaning, people are coming in saying, hey, you need to check out this person, or, people are being more forthcoming with symptoms, to get back to the quality improvement end as well. If they have implemented some strategies to overcome the challenges that we've identified, we could then ask about what their experiences are. Have they been successful in, what, or even be specific as what measurements are they using to identify if those programs have been successful.
What do y'all think about how, let's say we were doing individual interviews on these athletic trainers, and then we see common topics. I feel like in quantitative research, we're talking so often about keeping things consistent. But in qualitative, if the first 5 people we start seeing patterns, if we ask the next 5 people about those specific patterns, like more about them, more probing questions, would that affect the quality of the research?
I would just be worried about leading the question too much, not being as open, I guess.
That makes sense.
Yeah, I mean, this is a very new world to me.
Yeah, me too.
I think what I like about it is some of the freedom to be, more semi-structured versus fully structured in the, data collection process. And I think for me, it would come down to, this group, something like that, identifying as, have we got the core principles that we want to identify with the part of the interview that's structured? And if we truly feel like we do, do we get an outside opinion, to establish some validity to the tool to say, is there anything that you think that we're missing? Because I think that helps answer the question as far as data saturation. Like you said, if we're getting 5 people in a row that are all saying exactly the same thing, and we've agreed, and we've had some other people that are external to our study agreed that we're asking all the right questions, then we might just be done with, we might just get the information that we need. So I think that kind of comes into a little bit of the peer review process and understanding about that. But I think it's a good point to understand if we're getting the same questions or the same answers, we have to decide, or is that the only answers that we need, or do we have to change the way in which we're asking the questions? The only other question that I had, just to throw up for a conversation, was about persistent symptoms and how that's managed. And I couldn't really formulate the best way to ask it. So I had just wrote, how does your school manage students with persistent symptoms following concussion? And the more we've talked, the more I think I would probably word it along the lines of, what accommodations have you put in place for students that struggle, or the students that have challenges post-concussion specifically from a cognitive standpoint?
So like missing class and stuff?
Yeah, I would be interested in, I have a lot of ideas of what could be done, but I would be interested in that interview process, what they would have to say about, we allow half days, or, the guidance counselor coordinates with their instructors to get their work sent home to them. We ask them not to come to school, or, I would just be really interested in that whole return to learn process and trying to formulate a question around how that's dealt with when symptoms last longer than a week to 2 weeks that we might suspect for most concussions.
Yeah, I like that.
Or even at what point, if any, would you be concerned, or does academics have a place in the management?
Yeah.
Because like you're saying, maybe a week they have prolonged symptoms, but I know sometimes we take our athletes out of school like the first few days because of severe symptoms, while others, it's like our doctors are like, well, if they can tolerate sitting in class, that's fine. Like at what point do their doctors even draw the line, or who does draw the line to get academics involved?
Well, and I think that could kind of go back to, Megan, your question about education for coaches and stuff, including asking if they include teachers in that as well, to kind of, for them to understand the persistent symptoms that might occur and them actually having to miss class. That might be interesting.
So I just want to make sure that we're going through the criteria here, because I feel like our discussion on the actual questions, if we were going to continue to do this research study, went fairly well. Like we seem to all be on the same page. I think we have a good mix of, mostly open-ended, unbiased questions, a couple close-ended ones with follow-up questions that would then get at the information we wanted. And to be honest, maybe more probing questions than we actually need based on all of the discussion that we have. But, so I feel like we've hit a number of the bullet points that we were meant to discuss, but I'd be interested in the rest of your opinions on, is that enough questions? Do we need more that tie back specifically to the research question? Because I feel like for me, I was just like, okay, well, what are all the things I care about concussion? And want to make sure that it's looked at through the lens of the specific question, the research question that we were given, specific to management and referral.
And it's almost like, are we focused so much on the plans versus their actual experiences? Would be the question that I would have, because we do want to know their plans, but how well, and we have several that do implement that, but I think we would just have to be careful in, like you said, tying back to the question.
Yeah, I would be concerned with adding more questions than what we have already, concerned with getting too specific.
Yeah.
Because we do want, like you said, Megan, more experience rather than, so how does this work for you kind of thing, you know what I mean?
Mm-hmm.
What about specific to that end, and at the risk of adding another question? So I do, and we could even easily find whether or not there was legislation in all 50 states. I think there is. So maybe the original question that I had proposed about, is there law governing this concussion management, we would just throw out because we could just assume that there was. And we could change that to a question of how has your experience managing concussion changed since whatever local or state law that you are subject to has been implemented.
Mm-hmm. When did that change go into place?
Yeah.
How has it affected you, kind of a thing?
Which I guess we would have to look up. We would be able to tell that because I guess the criteria doesn't really list, are we looking at high school athletic trainers in a specific area? Because if so, we would be able to know the specific law.
Sure.
And base our question off of that, since that would probably be pretty consistent.
Sure, yeah.
Looking at the sheet, the only thing that I don't think we've really covered much is order, as far as how we would go about ordering some of the questions that we had listed. I mean, it makes sense that we start with the general, talk about your role and what your day looks like as the beginning of the interview. But any thoughts that you have regarding, I mean, we kind of threw a lot of information at each other in a quick 15 minutes there, as far as going through the questions. Would it make sense to just discuss, we don't have to rehash all the questions, but if we could classify them as, the policy and procedure questions, the experience questions, the referral questions, what are your thoughts on how we would order those if we were going to actually do these interviews?
Maybe if we started out with the more structured and work our way to experience, like the things that are set in stone at their workplace, then going with the doctors, nurses, and their roles in it, like you said, and then how they actually manage it, like the implementation of what we had just talked about.
Right. And for someone who like me, who likes to talk, those can kind of lead into the experiences. So we wouldn't necessarily even have to answer or ask those questions. They could kind of just roll right into them, in a sense.
Or I would think somewhat organically, with the freedom that we might have based on the responses we get, the experiences could just be the probing questions themselves. The structure of the interview could be that we ask those questions about policy and procedure, and then what their management plan looks like, and then at each point say, and what has your experience been in the success of that plan, or how has the experience of the student athlete been based on conversations that you've had with them, or things like that.
Yeah,
that would be a thought for a structure of the interview.
Yeah, I really like that idea, for sure.
I think we're unbiased. Well, I think our questions are unbiased. I'm sure we all have bias as far as what we think the answers to these questions should be. But from what I've heard on our discussion, I think that they were relatively unbiased.
I think it would be hard to have a discussion with them. I mean, I guess one thing is, how much conversation are you having with them? How much feedback? Like, are we asking these questions and then we have probing questions? I think the probing questions would be the ones that would be more likely to be biased.
Yeah.
Or to, because those may not be as consistent because we're going off of what they just said. So would our response to what they just said influence their next few answers?
Right.
For the direction it goes.
So it could come off as kind of judgmental in a way? Is that what you mean? Yeah. I guess we'd watch the tone of the questions. Just be sure that you're not conveying your own personal beliefs. Yeah.
I don't know. I think we did a pretty good job, personally.
Yeah.
We got to make sure we say that for whenever Dr. Bagan watches this.
think we deserve an A.
Yeah. Well, no, that's not unbiased.
Right.
Points off.
I will be very upfront in that I probably don't have enough done with the actual overall project for the course to use any of this time to talk about that, because it just says it on the last thing, optional. Talk about your personal projects if you guys. But if you want to, I have the time. I'd be happy to listen to or provide feedback to anything for your projects.
Mine keeps changing. I have a general idea, but I keep going back and forth with it. Mine's with education.
Like I said, I don't have enough done to share with anybody. I didn't hit the week 4 optional deadline to submit for feedback, so.
I haven't gotten to the interview questions part because I'm going to do the psychosocial support of ACL, those who tear their ACL in their first year of college athletics. Because I happen to have 3 people that I know that have torn theirs in their first year, of playing sports. Mm-hmm. At the college level, and so just kind of questioning them about what their support system was through that process, what was most important, and just that way we get an idea of, because how people fall out of rehab sometimes because they don't have that support, or they're left on the edge of their team and things like that. So to get that qualitative perspective from them may help us give them better support. So that's kind of where I'm trying to go with my project.
That's interesting. I would be interested in if you got into questions about what their, a timeline of what their goals were. One thing that I always, and I'm guilty of it just like everybody else, but see that, we as athletic trainers assume that their goal is to get right back to sport. So we just focus on, okay, let's get back in the game. But, the whole psychological process of dealing with surgery in general, and, I just want to be able to walk without crutches, or, I want to be able to go out to dinner with my friends and not worry about, there are a lot of stairs or, things like that. I'd be very interested to hear how that goes, because, as far as what we see regularly, which it's a very often occurring injury, that's one that happens very frequently. So, it would be very helpful to understand that process.
And such a long-term process.
Yeah.
They can sometimes have so many setbacks.
Have you gone through that process?
I haven't. I've had quite a few people that I've helped through the process, and they're just such different mindsets. Yeah. You have somebody who's super motivated and has a great support system, and then you have other people where they're on the edge of the team, and this injury really isn't helping them get their spot on the team, and just very different social support. So
I would imagine it would be, had you been someone that had torn and gone through the rehab, that it would be even harder to not have biased questions.
Right. For sure. Exactly.
Considering that I'm the athletic trainer for most of the athletes returning to play, though, that might be a little biased.
Sure.
Hopefully for the project, it won't matter.
Well, good luck. I'm glad that you're that far along. I'm jealous.
I'm in the beginning phases of like I said, so my original question was if we increase computer-assisted learning in athletic training education programs, if that increases BOC pass rates. Mm-hmm. Because I think that not necessarily completely online, but more hybrid type education, I think would help with kind of feeling more comfortable with the BOC. Mm-hmm. Since it's all computer based. But then it kind of, because I'm in HIT right now also, it kind of turned into, well, our students don't really know about health informatics and don't really know about health information technology besides just the software databases that they're utilizing in their clinical sites. So kind of turned into more incorporation of health information technology and health informatics into education. And so I'm still kind of tossing around stuff.
So you're determining which one to do according to which one you feel like is the most beneficial?
Yes, in a sense. I do believe that technology does need to play a higher role in athletic training education than what it already is. Students need to have more experience, I feel, with just technology as a whole in the clinical setting and the classroom setting to help them in their careers. But besides playing on their phones and stuff, But I'm trying to figure out a good balance of both because I want to utilize both, but just trying to find the balance, I guess.
Mm-hmm.
And there's so much technology there, even with looking at biomechanics.
Right.
Because I feel like that's a tool that athletic training students could use pretty well.
Right.
But how many resources do they have with that, or projects to go into that?
Right.
Interesting.
Yeah. We'll see. That
Great.
it?
Well, anything else that anyone thinks that I really don't have anything to share. Like I said, I'm trying to be very politically correct and not saying that I haven't done much on the project yet, because I was on vacation at the beginning of this quarter and then moved from Boston to Chicago, and now I'm just kind of getting caught up with my life. So
Congratulations, you need a new job, by the way.
thank you. Yeah. It makes this a lot easier because I actually have an office now. I never had that before. So
Yeah. I'm good.
well,
Yeah.
thanks. This was really easy and
Yeah.
fun.
I'm glad
work.
we got it done.
Mm-hmm. Check it off the list.
Yeah, seriously.
I'll email Kaylee and let her know that this seemingly went well and that she should just expect to get it from you, Danielle, because I think you're the only one that will get the actual video file.
Yes. I'm hoping I don't mess this up.
Okay.
Okay, well, here's hoping.
All right.
Sounds
Have a
good.
good afternoon.
All right. Thanks, you too.
Okay.
Bye.
Bye.